Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome two guests today to this very special program on the topic of sex in older adults. First, Carolyn Stegman. Dr. Stegman, you are a consultant at MAC Incorporated, right. And you also were a professor at Salisbury University for 25 or so years, teaching psychology and communications.
Yes, adjunct professor in psychology, right.
And now you do a lot of important work with MAC. And Bonnie Brown, you're my colleague at Salisbury University. You're a professor of nursing, and you focus on community health and psych issues as well. So again, thank you for coming on the program to talk about this topic that I think a lot of people, are a little skittish about, but we're going to take it head on and talk about what's going on in terms of sexuality in older adults. And I know a lot of people think, oh, they don't have sex, but they do. And I know you have some statistics you would like to share.
There's two things that I want to start with. And the first statistic is that the majority of older Americans are sexually active. And they view intimacy as an important part of their life, and this interest and the interest in sex carries well into their advanced ages. And these are not just statistics from, lesser journals or whatever. They actually come from the National Institutes of Health that are printed in the New England Journal of Medicine and the Mayo Clinic and so on. The second statistic that is very important is that when bothersome problems occur in sex in older adults, that many of those older adults do not talk to their doctors, particularly women. A lot of times men will, because we've seen all these commercials now, the people that are in two bathtubs and that type of thing, that are saying when the time is right, and Viagra and Cialis and all that kind of stuff. So a man is more apt to talk to a doctor than a woman is. And the doctor is really pivotal sometimes when you do run into some problems with sexuality. And the other things is doctors don't always ask. So if you're going in there for your arthritis or hypertension or whatever, it might not come up. Is everything good with your sex life? And so those are the two things, is that most people want to have sex and are having sex, and when problems occur, they don't often talk to their doctor, or the doctor doesn't ask.
But do you think part of that is a generational thing? And, my parents were much older, and they were from that generation where, you just don't talk about things like that. But I think we all know that with this current generation of baby boomers who are much more informed and using the web and want to speak up, that maybe that'll change.
I think so. I think people want to talk about it, but sometimes it still presents that uncomfortableness when you're talking about perhaps the most intimate of feelings, and you're talking about it to a stranger. And sometimes when things happen in the marriage, like somebody's had surgery or intercourse becomes painful, sometimes they almost give it up as opposed to solving the problem. And many of the problems that come up can be resolved, but it starts with communication, not only with your partner, but with a physician.
Well, the other thing, too, we live in a society where there's so much emphasis on youth and beauty and, the body. And I know there's a lot of societal attitudes about the aging process as it is. And I know, common roadblocks we'd like to talk about are the fact that a lot of people, I don't even know if you have to be an older adult, are just embarrassed about their bodies, that you don't measure up to the celebrity or whatnot. So
body image is a big factor. I mean, let's face it, we all, as we age, get more cellulose, and we, have more wrinkles and so on like that. We gain weight. And sometimes that image can really affect the self-esteem and how much, we don't feel as sexual and as alive as we used to be. But it's not about body image. Sex is not about that. It's not about that.
It's much more complicated than
that.
Yes,
exactly. And the other thing I want to say, too, is we're in an age-phobic society that we're only beginning to reframe. That age is vital and wonderful, and as opposed to the burden and the end-of-life issues. Go ahead.
I do think that sometimes as we begin to talk about sexuality, there is a notion that sexuality really only has to do with sex. And I think that one of the things that it has helped me as a healthcare provider and an educator to view sexuality from a model that looks at the complexity of it. Reducing it to the note, if you just view sex as genital interaction, then you're really missing a major part of it. Mm-hmm. And the particular model that I try and help students use to view sexuality is a 5-part model. And the first thing it requires us to view is that a big part of sexuality is sensuality, and that's the use of all of our senses to enhance the sexual experience. And I mean all of our senses. So for someone who perhaps isn't able to hear, then the use of vision and touch is going to be more important. Smell is an important part of our senses, and so enhancing the sexual experience with smell, for example. A lot of our early memories of our sexual experience may be related to cologne or something, related to the sense of smell. So enhancing sexual experiences through the senses is an important part of sexuality.
Of course, the skin is the largest sex organ.
Exactly,
correct?
the skin is the largest sex organ. So touch, for a lot of people, is really pivotal to a meaningful sexual experience. The second part of this model has to do with intimacy, and I think that for a lot of people, sexual experience requires a degree of intimacy, and that means the ability to communicate and to verbally share things. Mm-hmm. And sex without intimacy, I think a quickie is the classic example of that. It meets some physical needs, but there's something missing without intimacy in a relationship. The third aspect of this model of sexuality has to do with identity, and that has to do with your maleness and femaleness. And if you were brought up to believe that good girls never initiate sex, that for a woman whose partner is unable to sexually perform, the woman may be somewhat reluctant to initiate things, and that's really important as we move toward a more equal sexual focus, I think. Mm-hmm. Another important aspect of this model of sexuality relates to reproduction. And I think for a long time, that's how sexuality was viewed. That reproduction is what we called sex. Mm-hmm. And that would refer to people's ability to have children or not have children, to sexually transmitted diseases, and really issues related to contraception for folks. So, but reproduction is just a little tiny piece of sexuality.
Yeah, some people from that older generation, certain religious faiths, that's what they said.
Exactly.
You only have sex to procreate.
Exactly. So a lot of folks have that view. Unfortunately, or fortunately, there's more to sex than that. And the final aspect of this model of sexuality looks at a concept called sexualization. And that is the use of sex to manipulate or control another person. And whether we're talking about sexual harassment or abuse, or even the simple quid pro quo. If you mow the lawn, there may be a sexual favor in it for you. I mean, that is really the use of sex to manipulate. And all of those are aspects of sexuality. So I think that's the main thing folks need to understand, that it's very complicated and it's so much more than just intercourse.
I agree, and I want to go back to also the aspect of touching when you were talking about that the skin is really the largest sex organ, but there's also another very important sex organ, and that's the one between your ears. That sex is really an emotional and mental state, and sometimes in sex, when you look at body image, we're our own worst enemies when it comes to that, because again, when you were 20, you could say, well, I used to be a 10, and it was just so different. But now that I'm 60 or even older, because many people are having sex well into their 80s and beyond, it is different, but we must look forward and not backward. We must say, okay, yes, our bodies have changed, but that doesn't mean that sex has to stop or that it has to become boring or less than intimate and so on like that. And I would also like to stress that there's a disease, and we'll be talking about diseases in just a minute, but one of the big diseases I call is skin hunger, and that's the lack of being touched or caressed. And a lot of times, you know, we touch and we hold babies and touch them all over their bodies, and it's so cute. But sometimes once somebody gets older, they become the untouchables. We don't want to touch as much, and it's very, very important. And particularly in a relationship, a monogamous relationship, a marriage, to maintain that sense of touch and intimacy that you're talking about.
I think folks really do crave touch. We're busy, and just seems that that's something that isn't happening and it certainly can be a prelude to intimacy.
Absolutely, and afterwards
a good prelude.
too. I remember one time I was in graduate school, and that is very long ago. The professor in my human sexuality class said you can make love with your clothes on. And at first, you know, of course, I'm only in my 20s, newly married, and so on. I'm thinking, what, you know? But it's true, because making love can be done with your clothes on, with the touching and the massage and the talking and communication. Right. That brings the people closer together.
Again, that idea of intimacy
That's
requires more than, I mean, it's not simple. Intimacy requires effort.
Right.
And for a lot of folks, that's they don't know quite how to go forward with that.
That's right. And it seems to exacerbate the problems when we're old because of our societal attitudes. Like, I had a woman come to me one time who was 80 years old, who had been married almost 60 years. And her husband has arthritis, and he uses a walker, and she's had some things, so sometimes her posture is not upright either. But they were walking down the street holding hands. And somebody walked by and said to them, "Aren't they cute?" Mm. And she was angry.
Of course.
She said, "Why should I be reduced to a fourth grader? I've been married to the same person. I'm holding his hand, and I'm relegated to cute." You know, and that's a lot. It says a lot about what we think about aging and sex. Is we think of aging people as asexual, that they're not
interested. We don't
interested.
want to think about aging, about
That's
people
right.
who are older having sex.
That's right. And with aging, it's going to be slower and take longer, but there's also going to be more rewards in that.
Exactly.
Because they have a lifetime of being together.
And Carol, I think one thing we wanted to bring up before we go into some of the normal changes that do affect our bodies in terms of sexuality and such there's many, many benefits to sex in later life, to sex in general, of course.
It's healthy. You know, we worry about our physical and mental and spiritual health. We're always talking about those all the time. But sexual health is equally as important, and it's right up there with all the other things. It's like, it's exercise, it's good for the heart. People that are sexually active literally are going to live longer. It's like, it's healthy, like eating fruits and vegetables. I mean, it's something you can do for yourself. It relieves tension, it's exercise, you know, and all those things. And of course, we're going to get into the aspect that sometimes older persons don't have a partner, and we'll talk about that later. But there's ways around that too.
Sure. So I know there's research out there that it does increase the lifespan, and of course solidifies relationships and helps with that emotional component that we all
and we're talking about major medical things. The articles that I've read recently, again, as I said before, have been from the Mayo Clinic and all kinds of really reputable organizations. So this is not just something new. It's really coming out, and it is being researched much more than before.
Well, let's talk about some of the normal physical changes in the body, because, you know, number one, they do happen, and number two, we're going to bring up some suggestions of how to, you know, address these things. And we'll start with women. Vonnie, you want to talk about some of the normal changes in the body for women?
Well, I think that depending on when menopause may have occurred, they may experience atrophic vaginitis, which means they are drier vaginally, which can make sex pretty uncomfortable. And you know, one of the things that we've learned are that there are a lot of different kinds of sexual lubricants and aids that are really make sex more pleasurable for women who are experiencing atrophic vaginitis.
Absolutely. We used to just see KY jelly.
Right.
Now they have all kinds of things.
All kinds
you know,
of
it's a whole big section in the supermarket.
Estrogen creams, you know, because the bottom line is, if it hurts, you're not going to want to do it. It's not going to be pleasurable, and it's going to be a painful experience. And that, again, is something that we can do something about.
Right, and women just need to be aware that this can be a normal part of aging.
And what about decreased libido or sex drive? That's a problem. It happens in men as well, but
certainly, and that's I think a lot of that has to do with other physiologic changes that may be going on. But I would go back to the idea that a lot of decreased libido has to do with the way we're thinking, and to continue to view yourself as a sexual being throughout your entire life certainly has something to do with that. I mean, the way we dress, the way we perceive ourselves as sexual is really important to making you feel more sexual. You have to believe that you have sexual capacity.
That's right. I agree totally. I think it's just, you know, again, going back to the body image, you know, women saying, oh my gosh, I'm old, I'm gray, I'm wrinkled, I'm things like that. Therefore, I'm not sexual anymore. And it's not true. It's not about that.
it's how sexual you are to your partner, you know, and
That's
I think we
right.
put ourselves under a microscope in terms of the greater society
always
and the
very
celebrity,
critical.
you know, and it's really the way you look to your partner.
Right. And if you remember that model in terms of identity, how you view yourself is going to be a very, very important part of how you how you are as a sexual being. And I think it's so funny. There's so much sexuality in the media, and yet it really doesn't always portray. It often does not portray older adults as sexual.
Not at all. I think the latest movie we saw, Hope Springs, is just out right now. And we saw a movie with Jack Nicholson and Diane Keaton. I think it was Something's Got to Give or something like that. And so it's beginning to have older people in a situation where they're making love. Hope Spring, I think, is a good movie in terms of bringing the subject matter forward. But it was not a good movie in terms of their communication, in terms of you're talking about a couple who are living in 2 separate bedrooms and are not talking, times 5 years, which really, you know, reeks of pathology, actually, and yet they solve it in 2 hours. So
Only on television,
Right.
or
Thanks to
on media
Hollywood,
in
yeah.
Hollywood.
you know, I think that it's important to point that out, that the movie would really be very funny if it wasn't so sad that this couple has such a strange relationship. And I'm glad it worked out for them at the end. So it's a good start, and
Yeah.
we're getting there.
Well, you were mentioning decreased sex drive, and you're saying a lot of the problem can be for women if they're having pain during intercourse, and of course they're not going to be as interested in it, but the painful issue can be addressed with lubricant or talking to your doctor.
Exactly, and talking to your partner. And a lot of times when women have painful intercourse, they'll tend to not want to do it and not want to do it. And all of a sudden, time has gone by and the couple sort of loses ground. So instead of trying to talk about it and resolve and get through it, they distance more. And because they're, again, afraid to talk about it with each other, let alone a doctor.
Or the woman may just suffer and just say, you know, let's just get through this.
Right.
And
But
type
the
of
suffering
thing.
can
Yeah.
also lead to cystitis and other things which are going to be very painful then on urination and are going to require antibiotics and so on. So that can happen. And the walls of the vagina change. You know, they dry out, they thin, and all kinds of things like that. So lubricant's going to be very important. Lubricant's actually very important for people of all ages, but particularly an older adult.
Yeah. All right, let's talk about men. Of course, this is
Let's
out
do.
there. Well, of course, none of us
Here we
are
are.
men,
It's
but
very interesting that our
we've
panel
seen
is
the
women.
commercials, yeah, talking about erectile dysfunction,
Okay,
which has
well, first
become
of
part
all,
of the vernacular
Let's
now.
define it.
Yeah.
Erectile dysfunction is the inability to maintain or have an erection and maintain an erection. And it's very common. It's something, again, that has solutions. It can happen with age because of decrease in testosterone and other things that are going on in aging bodies and so on. And sometimes, again, not being able to maintain an erection is going to make sexual intercourse more difficult. And again, it's going to weigh heavily on the self-esteem because a lot of men in our society have been taught to perform. You know, and if you can't perform anymore, you're less manly or something. And so, and then that coupled with a woman doesn't know how to talk about that
Right.
or how to interact with her partner, and it can lead to some problems which can, for some people, stop intercourse altogether, like in Hope Springs, and they can't get back on track unless they begin that communication.
Of course, I know one of the things you really want to emphasize is there's some non-drug methods first versus just saying, let's just take a pill. I mean, that's the way we are in this country anyway, try to solve every
Exactly.
problem with a pill
Exactly.
and medicine. So
Exactly. And I think that taking the pill you know, precludes, you know, having communication. I mean, fix it, let's fix it. And sometimes it's not as easy as popping a pill. And sometimes some men cannot take that, because if you have heart disease or other things, there may be contraindications.
Right, with the nitrates.
Right,
you know.
exactly. And so also, I have told a lot of students that are going to go into the aging field is to promote counseling, because a lot of times if the couple cannot do it themselves and talk and communicate, then sometimes a third-party neutral talk therapy will help them to get through those periods, and then coordinate that with a physician and those aids that can be given, and you can find yourself in a very different, beautiful place.
But I think part of the key here is to go to a third party. You have to acknowledge and discuss and be willing to address the fact that things aren't ideal. And again, discussions related to sexuality are pretty uncomfortable. They're uncomfortable for the general public, but also among a couple. I think that really,
Absolutely.
can be a difficult conversation to have. We talk about intimacy, and yet when it comes to talking about sex, we don't necessarily do as well.
Or go back to the movie Hope Springs. If any, look how uncomfortable they were
Exactly.
in that office for days, really, before they finally were able to express themselves.
Let's face it, I think a lot of younger couples,
Exactly.
you know, it's
Absolutely.
just very uncomfortable to talk about it because of the self-esteem and the performance pressures and stress, and you know, all of us lead busy lives, and sometimes there's just not a lot of time for this kind of thing, especially when you have kids. Which the
Exactly.
plus of older adults is, you know, you usually don't have
children
those
should be gone.
constraints.
Although more and more
they're coming
they're
back.
coming back, exactly.
Well, I know a lot of men, particularly baby boomers too. We were raised in an era of John Wayne and Harrison Ford and all those macho, where it was basically don't mince words, don't shun an unnecessary fight, and be sexually potent. I mean, they were the things. So the performance, again, becomes a lot of pressure. And the more pressure you put on yourself, the less apt you're able to perform, really.
Exactly. I think that's a real challenge.
Now, I know some other challenges we do need to address there are some illnesses and conditions in older adults.
And certainly sexual side effects are very common with a lot of different medications, and a lot of the medications that we need to use to address major health problems such as hypertension, with some medications there are significant sexual side effects.
Yeah, there's a long list of medications, and most older adults are on, you know, 3, 4, 5, 6. I mean, several of these.
They certainly can be. And yes, look at the
High
list.
blood
But
pressure
here's,
medicines. Yeah.
Here's a list that I found on NIH of some of the medications that for some people can cause erectile dysfunction or decrease libido or desire or painful intercourse or any of those number of things. And this again is where the doctor becomes a team member for you to look at this, because for instance, here's the hypertensives, and they can be changed. So a doctor
Right,
can
there's
change
lots
to
of
another
different
drug.
ones, yeah.
Yes, and let's not forget to include recreational drugs such as alcohol, again, where one drink might be nice, but over too much indulgence, of course,
Right.
can decrease all those
I know
things.
alcohol for some people loosens them up, and you know,
Right,
but then
exactly.
too much interferes.
Exactly.
Yeah.
And I want to also stress that aging is not a disease, and it's a time in life. But along with aging comes the increased incidence of some disease, chronic diseases such as diabetes, hypertension, heart disease, possible stroke, arthritis, chronic pain, all those things that can affect our physical health and then go down and affect our sexual health, our spiritual health, and our mental health, even elderly depression, which can come after lots of loss. I mean, let's face it, many older people eventually lose a partner, so that the intimate sex life that they had with this one person for many, many years is over. And that's depressing. And so
Yeah, friends dying, and you know, not just a
friends,
partner, but
loss.
friends, or it's a lot of loss that can
Unfortunately,
go on.
loss comes with aging. Loss of our physical well-being the way it used to be, loss of our friends, loss of driving, even retirement can cause, much change in our life, which can affect our sexual health.
And I know there are a few surgeries, they're pretty cut and dry. They can have an impact on things, and that needs to be taken into consideration, or talk with your doctor about these kind of things.
Although we often do say talk with your doctor, but again, for a lot of people, they're better. They have a wonderful relationship with the nurse in their physician's office, and
Absolutely.
And I've actually found that nurses are really great resources in terms of information about sexual side effects, about even healthier positions. For someone with chronic lung disease, ideally, missionary position is not a good place to be. If you have chronic lung disease, you really don't want someone on your chest. So really, the person with the lung disease should be on top. And I think simply sharing that kind of information with folks is really helpful. But in order to share that information, we have to be comfortable with our own sexuality enough to open up discussion about better positions or better methods.
Right, and that same can be said chronic pain or arthritis, that positions are going to change over the years, and you're going to be more comfortable and definitely experiment. The other thing that would come with some surgeries, like for a woman, mastectomy or hysterectomy, and a lot of times that takes blows on one's body image and self-esteem, and one needs to talk about that and look at the difference. I know now, particularly for younger women, are opting into reconstructive surgery. Older women, not necessarily, but some do. And but again, that needs to be talked about. That's very important.
I know we wanted to get into the more positive thing, tips for better sex. And I know one of the things we kind of mentioned is, you have less distractions, and you don't have little kids running around and all the stresses that you can have when you're raising a younger family. And also there can be the positive of having self-confidence in your achievements as you get older and wiser and feel like you've done a lot of good things.
Right.
And that certainly can help self-esteem.
Absolutely, I agree. I think that taking time, more time, which most of us are going to need as we get older, foreplay, playfulness, setting the stage, doing things together, holding hands, all those kind of things are going to lead to healthy sexuality. And go ahead.
Yeah, no, I just wanted to expand on that. I know, Vonnie, you mentioned earlier we have to expand our definition of what sex is.
Exactly.
That it's not just the quickie or,
Right, it's not just genital interaction. It's much more than that. And if you think about the model that we talked about sensuality, I mean, for some folks, the lighting, the smells, again, using all of the senses to enhance the sexual experience makes sex a richer and fuller experience. So, if the use of pornography, I mean, for a lot of folks, that's a sexual stimulant. So if that works for you, then you and your partner, should enjoy that together. But I think that it has to do with thinking broadly and communicating what you like, what you don't like, what is erotic and what isn't erotic for a partner.
Right, exactly.
It comes right down to being able to communicate.
Yeah, talking about it, and I think that's a problem that a lot of people have. Very uncomfortable.
I mean, actually, even to do this session, to videotape this, you have to really sort through your own thoughts and attitudes about sexuality, and even folks who are able to talk about sex, you have to sort through find your own level of comfort.
Right. And also the aspect of older adults without a partner, I think that's important to include the whole concept of masturbation and self-love, and that a lot of older Americans are masturbating, and either with toys, sex toys, or whatever it might be. And that's very important to again, when you look at the healthy aspects, the physical and mental healthy aspects of sexuality, that if you're partnerless, to be able to continue that is very important. And the other thing is that if one does find another partner and begins to experience sexuality with somebody new in their life, is don't forget about STDs. While you don't have to worry about reproduction, we're definitely we're seeing an increase in HIV and all kinds of sexually transmitted diseases with older adults.
So you still need to use
condoms.
Exactly.
Just like we preach to our young people.
Exactly. Exactly. Same.
Because we're seeing more of this, with you're saying the partner gap, and then people having sex into the older years where they're with a new person, and you need to be careful. Yeah, yeah. And Vonnie, I just want you to expand a little bit more on the experimentation thing. the importance of changing up the routine, and of course using lubrication in different positions depending on what's more comfortable for you. And I know you were mentioning when we were talking about the program that with the woman on top, it's less important for a man's erection to be hard.
Exactly.
So that may be the way to go.
Exactly. I mean, certainly trying different positions, trying, whatever works for you. I mean, I think that, but again, people have to be able to talk about it. The couple has to be able to talk about what feels good and what doesn't feel good. And I do think that the conversation is key. And if it doesn't feel good, then you need to say it doesn't feel good. Not expect your partner to be able to read your mind. I think that's
even if you've been
together
married
for 50 years. Exactly. And don't assume anything.
And what used to be fun for you at 30 might not be at 60. So everybody changes.
Exactly. Now, I do know we want to emphasize a few key points, and then we'll talk about there's a ton of resources out there, books, articles, website articles. In fact, I brought a few books that I found just looking online. I haven't read any of these yet, but I just wanted to mention that there's lots of books out there. I think a lot of people have heard of Dr. Ruth Westheimer. I know you.
Yes.
She has a program.
In fact, when I was looking up some information about this program, I went on to YouTube, and she's got tons of videos on every subject. And here she is, Sex After 50. And I think that that's just so important to be able to read a book like that, and just get it from Amazon.com and start reading. It'll really be helpful, and read it with your partner too.
Right, and I know she is big on the importance of masturbation, to pleasure yourself, especially with the partner gap and such. And,
absolutely.
You have to give her a lot of credit because 10, 15 years ago, she was out there talking about this when a lot of people were very uncomfortable.
And she still is. In her like 70s.
Here's another one I found, Better Than I Expected. Straight talk about sex after 60. And then, of course, we have the 50 Shades of Pleasure. We have 50 Shades of Grey. And, of course, another great resource, Carolyn, you've been talking about, the National Institutes of Health has the National Institutes of Aging.
Their website.
That has
and you
great
can get right
information.
on, go to nationalinstitutesofhealth.gov or whatever it is. We'll have it on the screen. And then just go to sexuality. And there's all kinds of articles that come up, and they talk about various things, male, female, all kinds of things like that in communication. But the bottom line is most point to communication as central to starting any talks about anything.
So if I said, let's summarize the top 3 points, I think we'd say communication.
Exactly. Exactly.
Right.
I think that's probably in my opinion, that's certainly one of the most important aspects.
And certainly the importance of hopefully feeling comfortable enough to talk to your doctor if there's some physical issues that
Or
you
your
need to
nurse.
address.
Or your nurse.
Of course. Healthcare
Exactly.
provider.
Healthcare provider.
Let's face it, here we are.
Here we are,
three nurses.
three nurses,
Exactly.
exactly.
Sorry about that.
Bringing it up.
Yeah.
Maybe this is a first for
Or that's a
Pac
place
14.
to start sometimes. Sometimes
Exactly.
people feel much more comfortable talking to the nurse for a few minutes about it, and
Exactly.
then kind of get the conversation going with the physician if it's something that involves a medication or a physical issue that needs to be addressed.
That reminds me. Years ago, I consulted with hospice and about dealing with some folks who were addressing end-of-life issues, and I was completely unprepared for one, and I asked people to put their questions in a little bag, and I was expecting questions related to end-of-life, and actually there were at least 2 questions about sexuality, and my partner doesn't seem to want to touch me anymore, and I'm dying, sort of thing, and it was, how sad is that? But again, I think talking about our needs, our wants, and really taking it out of the box is critical, and I applaud us on our willingness to do this.
Sure,
to help
sure.
folks take the first step.
And we'll have information posted at the end of the program. And Carolyn, I think you also wanted to mention you have a book coming out?
Yes, I do. It's called A Gold Mended Life, and basically it's about a woman who's 60, who is partnered with somebody who's 65, and also one of the other main characters is 80. Healthy sex lives, and but looking at just the whole thing. The ancient Japanese have a tradition that when something is broken, instead of just putting crazy glue or throwing it away,
Duct tape.
Duct tape. That they mend it very, very carefully, and then paint the crack with gold, so that by the time they're finished, it is stronger and more beautiful than before it was broken. And a gold-mended life is about that. It's about that it's not over the hill or down the drain, okay? That it is a period in life which can be exciting and wonderful. And with sex, I view it as sexual health, and it's equally as important as physical, mental, and spiritual.
Well, hopefully this program is a step in the right direction to help change that mindset, because let's face it, you mentioned the brain being an important sex organ. A lot of it's about attitudes and expectations and just feeling good about yourself and approaching aging with a positive attitude. Well, thank you both for coming on the program to talk about this very important topic.
Well, thank you for the kind invitation to be here this morning.
I appreciate it too very much. Thank you.
And thank you for joining us for this edition of Focus on Health here on PAC 14.
Focus on Health is sponsored by Peninsula Regional Medical Center, a proud supporter of PAC 14 programming.
Hi, I'm Peggy Nalepa, President and CEO of Peninsula Regional Medical Center. PRMC is privileged to partner with PAC 14 to provide educational healthcare programming for the Delmarva region. Peninsula Regional Medical Center, a proud supporter of PAC 14 and public access television.